Welcome to the Transplant Institute at Methodist Dallas Kidney Transplant Education video series. This video will provide an overview of what happens once the Transplant Institute at Methodist Dallas has received a kidney that may be a match for you. When the Transplant Institute at Methodist Dallas receives an organ offer, we have 1 hour to respond to the United Network for Organ Sharing, UNOS. This means the call you have been waiting for can happen anytime, day or night. It is very important that your transplant coordinator has multiple phone numbers of family and friends on file in order to contact you quickly. During this call, you will be asked general health questions such as have you been sick recently, any recent hospitalizations, when was your last dialysis, any changes to your current health. If there are no concerns, you will be asked to come to the hospital immediately. To be approved for transplant surgery, patients must get through what we like to call the 3 hurdles. The first hurdle begins as soon as you arrive at the hospital. You will undergo further health screening to ensure you are healthy enough to receive an organ transplant. This will include lab work, various medical procedures, and an exam by one of our nephrologists. The second hurdle concerns the health and function of the kidney being donated. Some people are surprised to learn that when they are called for a possible organ match, the donated organ has not yet been recovered from the donor. Sometimes during recovery, the transplant team will discover that the organ is not usable after all. If the recovered kidney is healthy, the last hurdle is performing a cross-match. This is a test that mixes some of the donor's blood with the recipient's blood to see if there is a reaction. If no reaction occurs, it is time for surgery. Your surgery will last approximately 3 hours. Once surgery is over, you will wake up in the ICU and will stay for at least 1 night before being transferred to the transplant unit. The transplant unit is a dedicated floor in the Charles A. Sammons Tower where our transplant patients receive tailored care from medical staff with specialized transplant training. Most patients are in the hospital for a total of 4 to 5 days after their surgery. Before you are discharged, your transplant coordinator will arrange for you to have what we call transplant teaching, which will educate you on how best to care for your new organ and your body as you recover from surgery. This education includes a meeting with your transplant coordinator to discuss post-transplant care and follow-up appointments. One of our dietitians will visit with you to teach you about your new dietary requirements. During your transplant social workers visit, they will discuss with you how best to comply with your new medication requirements, attending necessary follow-up appointments, healthy living guidance, and support groups. Finally, a hospital pharmacist will meet with you to discuss your new medications. Once you leave the hospital, you will see your transplant nephrologist 2 to 3 times a week for the first few weeks. If your recovery is going smoothly, the visits will decrease in frequency over the following weeks. If you or a loved one will be traveling more than 120 miles to receive care with us, we ask that you and your caregiver remain in the Dallas area for 4 to 6 weeks. Speak with your transplant social worker to learn about lodging and transportation options in the area. We have a partnership with a nearby hotel to offer substantially discounted rates to our patients for their postoperative period, which includes transportation to and from the hospital. Thank you for watching. To continue learning more about kidney transplant at Methodist Dallas Medical Center, please view all of our education videos.